Good morning, everybody. Thank you for watching this video, and also thank you to the organization of the Open Science Conference 2020 in Berlin for making this remote way of presenting possible. Very happy that you're watching, and I would like to share my thoughts on open science, and the title of my presentation is In the Spirit of Open Science, Public Engagement in Psychiatric Research. But before I delve into this presentation, I will tell you a little bit about the research institute where I work, which is called the Rathenau Instituut. And I imagine that some German watchers may think Rathenau, the name sounds familiar. We were not named after the former Prime Minister of the Weimar Republic, but we were named after his brother, Gerhard Rathenau. We were founded in 1986. We are an independent research institute funded mostly by the Ministry of Education, Culture and Research. And our mission is to stimulate public and political opinion forming on the social aspects of science and technology. We do so by performing research and organizing debates relating to science, innovation, and new technologies. And our target audience is the Dutch Parliament, General Public, and the European Parliament more recently. So to say, we are a research institute, but we're not within a university, a Dutch university. And just to give you some idea of our size, we have about 55 to 60 employees. So that's where I work. That's my employer. And to start this presentation, I am going to start with my take-home message, actually. The three conclusions which I think are most important to take away from this video. And then afterwards, you can just sit back and relax, and I'll build up to these conclusions from there onwards. But at least then you know where I'm heading, so to say. So the conclusion of my talk will be threefold. Firstly, I will argue that open science, although open access and fair data are a very important part of the open science movement, we argue that open science is not limited to just open access and publishing and fair data sharing. We also say that engaging the public should be integrally a part of the open science agenda. The second conclusion of this presentation is going to be that public engagement is shaped not only by its scientific context and in which domain we engage the public, in which field of research we engage the public, but also by its surrounding societal context. And thirdly, the conclusion of this presentation is going to be about the challenges which we face when implementing public engagement, when engaging the public. And we argue that the current organizational model of research and psychiatric research in particular is incompatible with meaningful public engagement, and thereby the societal impact of public engagement is limited. So I will return to each of these conclusions consecutively, but I would like to say that my first conclusion is mostly about the goals of open science. The second point and part of this presentation will be mainly focused on the practices of open science and public engagement, and the third mostly focuses on the challenges with open science. I'll first now start focusing on the goals of open science and why public engagement should be part of the open science movement. Well, I don't think I need to tell you very much about the background of open science, how it came about. You are probably all very much aware of that. But just to remind you, open science is part of the European Commission's 3 O's policy framework: open innovation, open science, and open to the world. And it is currently a key aspect of both European and Dutch policy, science policy. But it didn't came out of the blue. It's been based on many previous policy frameworks, which have aimed to bridge the gap between science and society. RRI has been mentioned during this conference already. You also all remember the SWAFS program by Horizon 2020, Science with and for Society. And also in Dutch policy, we have had many frameworks kind of building up to the open science movement, you could say. We have had the Dutch National Science Agenda being quite a big initiative, which have all built up to the open science agenda in the European context. But if we now look at open science and how it's mainly operationalized, we notice that there's quite an emphasis on fair data sharing, making data findable, accessible, interoperable, and reusable. Also, open source coding, and of course, the open access transition, making scientific publications openly accessible to the world. And from a researcher's perspective, this might feel like quite a shift in the way we work and in the way we organize research. Sharing your data in a fair manner requires quite a lot in profound changes to your data management. And also, of course, publishing open access, it changes our power relations with both universities and publishers. So it feels like a profound change in the way we perform research. However, looking at the goals of open science might be useful to see what open science really is about and what it aims. And therefore, I've taken the definition of the European Commission about what open science is and what it should be. And the European Commission says it is a system change allowing for better science through open and collaborative ways of producing and sharing knowledge and data as early as possible in the research process, and for communicating and sharing results. And I've highlighted these words: system change and better science. It immediately makes me wonder, what is better science? And collaborative ways of producing and sharing knowledge. So it's really about improving science through collaboration. And it aims for quite a profound change, a system change. And then further on in this definition, it also says open science increases the quality and impact of science by fostering reproducibility and interdisciplinarity. It makes science more efficient through better sharing of resources, and more reliable through better verification, and more responsive to society's needs. So it makes it more efficient, more effective, and more responsive or more relevant to society's needs. And that is something I would like to focus on, because if you look at open science as just being mainly fair data and open access publishing, then we say, as the Rathenau Instituut, that doesn't make science per definition more responsive to society's needs. So actually we wonder where this promises to open science up to society, where that's been left in the debate. We are lucky to have the OECD on that respect to back us up, because the OECD and also UNESCO emphasizes open science to be efforts to make scientific processes more open and inclusive for all relevant actors within and beyond the scientific community. And that's why we decided to, within this open science movement, to focus on public engagement and to have this connection with society and to study it. Public engagement in science is what we are focusing on, and it might be helpful to give you a little bit of an idea of what we mean by that. So we've defined the public as non-academic actors, being individual or organized, who take an interest in the research process and or its outcomes. Public engagement, the engagement part, is participation in research, in either the research process itself or the research decision-making process. And then science is also a very broad term, of course, can mean basically anything. We define that as publicly funded research in the natural sciences, humanities, and social sciences. So in domain, it's quite, we take a broad stand, but we do focus on publicly funded research rather than research in the private sector and R&D. So that's what we've decided to focus on in our research project. And then you might wonder why you would engage the public. It's part of the open science movement, but there are other arguments why you would want to engage the public in science decision making. And these can be divided into instrumental arguments and more democratic arguments. Firstly, it's meant to increase the scientific literacy of the public, and it introduces new research perspectives. So in the medical field, you might say that the research perspective and the healthcare professionals' knowledge on a disease can be complemented by the experiential knowledge of a patient having a disease. So it enriches the knowledge about a disease or about a topic if you include more perspectives. It also increases the societal relevance of research and the support and uptake of research. And I have a small cartoon to illustrate it. It says here, well, this pill may be revolutionary, but I'm not sure the public will be willing to swallow it. So you can, as a researcher, you can make all these magnificent ideas and innovations, but it won't be taken up by the public. It won't be accepted by the public if you don't consult with the public during the research process. So these are both instrumental arguments, arguing that engaging the public increases or improves the quality or the relevance or the effectivity of research of science. And then there's also a more democratic argument, and that's basically that we have a democratic right, a human right to access and sharing of knowledge, and it's also research also affects people's lives. And if it's affecting you, then there is you could say there's a democratic right to be engaged in it. And that was illustrated very well, I think, by the HIV disease, research on HIV disease, where patients also demanded a say in what research was done, saying if it's about us, it shouldn't be without us. Nothing about us without us. So that's more a democratic argument to just, as a public good, we should be engaged. However, knowing that we might want to engage the public, we could also see that it's not yet very common, and it's definitely not common sense to engage the public in research. We know from scholars that engagement is currently most common in research dissemination, rather than the agenda setting phase, whilst you could argue that in the agenda setting phase, the public can still have most influence on the course of research. And for my own research, I concluded that involving the public is not yet ingrained in researchers' culture, the way they think about research, the way they consider research. It's not yet part of researchers' structure, organizational structure, how we have organized our research system. And it's definitely not yet part of researchers' daily practice to involve the public. And public engagement not being an integral part of research activities also leads to some dangers of public engagement not being meaningful. It can lead to bureaucratization, just more forms to be filled out. It can lead to sidetracking and sidelining the public's input. That's what we call tokenism. And it can lead, especially in the medical field, to proto-professionalization, where the public is almost encapsulated within a research system. And researchers only listen to the public and listen to patients when they know how to express themselves in scientific terms, which of course excludes people who are not so outspoken. Therefore, we say that engagement with the public should be meaningful, and you can define that on two different axes, so to say. You could argue, or you could ask yourself, how is the engagement process organized in research decision making? And so that's on the process level. And on the outcome level, you could ask yourself, how is input from the public reflected in the decisions taking in research? So that's why we are focusing on what we say meaningful public engagement. And in this talk, it might be interesting to see for yourself whether you think that citizen science projects, as we know them now, lots of data collection by citizens, whether that's very much this meaningful, how it addresses this meaningfulness of public engagement. So within open science, engaging with the public is often narrowed down to citizen science, and we are arguing that there should be more to public engagement than just collecting data and by citizens. So I hope you can agree with me now that to attain the goals of open science, to make science more responsive to society's needs, we need to not only focus on open access publishing and fair data sharing, which are all very much scientifically internal processes, and which are very important for helping interdisciplinary collaboration and sharing within the research community. But we also need to engage the public, and we need to be more open and open science up to society. But then public engagement, very nice, but what is it and what should it be? And how does it manifest itself? That's what the second part of my presentation will be about. So we do not consider public engagement a monolithic concept. We say that it's shaped by its context, and that's what our empirical work has been about mainly. So here I will focus mostly on the study we've done about public engagement in psychiatric research. The guiding principles of our study were, first of all, that, as I said, public engagement is not something monolithic. It can take many different forms and shapes. And that also implies that learning from each other, scientific domains learning from each other, can be helpful. And there's different engagement practices which can be compared and from which we can learn. So that's why we decided to study the manifestation of meaningful public engagement, but also its barriers, benefits, and conditions in various fields. And we did so in order to discern lessons for meaningful public engagement and provide courses of action for researchers, policymakers, both within and outside of academia, and involved stakeholders to facilitate and foster public engagement with science. So we had 3 research questions, the first being what factors induce and shape the manifestation of meaningful public engagement with research? Then what are the benefits of and conditions for such engagement? And thirdly, what science policy measures may facilitate and foster this engagement whilst taking relevant contextual features into account, because that's what we started off with. That's public engagement is different in every context and every domain. So our, sorry for my notes. We had a threefold methodology. Firstly, we did desk research, studying Dutch and European science policy. And that was also part of the background of my first part of this presentation. And then we did 3 case studies, of which psychiatric research will be the focus of this talk. But we also studied public engagement in educational science and in water quality research. That's 3 very widely varying domains. They vary greatly in both the discipline and in the public benefiting from research. But we argue that each of these fields, so psychiatric research, educational research, and water quality research, indisputably impact society. They all have a societal component. And that makes this engagement interesting to compare. In our case studies, we did interviews with stakeholders. So in the case of psychiatric research, we interviewed representatives, experiential experts and psychiatric patients, researchers, psychiatrists, and policymakers. And we did a document analysis of the main policy and contextual documents in this field. We also did an overall analysis over these 3 case studies based on the lessons drawn from each case study individually. We try to formulate courses of action for policymakers, and we are currently in that stage of the research. Before I delve into the results of our research, it might be helpful to give you a little bit of background on the psychiatry field in the Netherlands, how it's organized, and how psychiatric healthcare and mental health care is organized. So as in, I think, all Western countries, psychiatry is actually a container term for a wide range of conditions. People are generally diagnosed on the basis of the Diagnostic and Statistical Manual of Mental Disorders, which is currently in its 5th edition. And mental health care in the Netherlands is organized in 3 levels. So we have GGZ Nederland, geestelijke gezondheidszorg, which is mental health care, which starts at the level of the general practitioner. Then we have the basic GGZ, and then the 3rd, more intensive level of mental health care is called the specialized GGZ. Care is very much based on the evidence-based medicine paradigm, in which standards of care, directives, and protocols are all based on this paradigm. And you probably all know that randomized controlled trials are amongst the highest, most important levels of evidence in this paradigm. So it's definitely RCTs are the golden standard, so to say, in mental health care in the Netherlands. But it is problematized at the moment. We have a movement called the Nieuw GGZ, the New Mental Health Care Program. Movement, basically, which takes a new perspective on psychological suffering and health. It places more emphasis on variation, adaptation, resilience, and the management of care for clients. And it aims to place more emphasis on people's individual needs and individual care paths. So that's important to know about the field of psychiatry in the Netherlands, so to say. And that's, of course, the field in which psychiatric research takes place. So our results were published in Dutch in a report called In the Spirit of Open Science, Public Engagement in Psychiatric Research. And in this talk, I will discuss the manifestation of public engagement, how it manifests itself, how it comes about, its facilitators and conditions for meaningful public engagement, and policy measures to facilitate and foster public engagement. So in contrast to what public engagement is generally focused on in this dissemination and implementation phase of research, in psychiatric research, patients have a great influence. They have a really important say, and it's getting stronger, and it's increasing their say in what topics is being researched. So we see a paradigmatic shifts almost in a research focus away from more biomedical research and more on research into recovery, empowerment, quality of care, and research into the quality of life of relatives as well. We also see that patients get a say in the programming of research. For example, by reviewing research proposals on societal relevance or relevance to them. Does this proposed research actually answer a question I have to deal with or I struggle with? And feasibility. Is this proposed research proposal actually going to work in practice with people with, like, from an experiential expert's point of view? And we see that in these research agenda setting and programming phases, research with patients calls for different research designs as well. So, as I said, the RCTs, or randomized controlled trials, are being problematized, being challenged, and people ask for more qualitative research, alternative research designs. So there is really a shift in the type of research, both content-wise and methodologically, what type of research is being done. Also, we see that in the psychiatric field, patients are really viewed as stakeholders, and they have a stake in the outcome of research, of course. Their expertise in mental health care and mental illness is developed from their patient perspective, and it's seen as complementary to scientific expertise of researchers and healthcare professionals. So that's what public engagement looks like, so to say, in psychiatric research. How does that come about? We have identified a number of facilitators for such meaningful public engagement. And first of all, you could say that people can relate to psychiatric care. It's close to their heart, generally, which may trigger their engagement, because psychiatric care is something they care about. So they want it to be not only about them, but also not without them. We also have we've observed that there is a relatively well-organized and clearly defined public community, which is being engaged. And that's represented by the patient organization MIND in the Netherlands. So we see that this context, both policy and in practice, facilitates the engagement and taking up of research of patients' perspectives in research. And you could also say that there's quite a fertile ground for engagement in mental health care. Patients in healthcare are being empowered in general. And this new GGZ, this new mental health care program and movement, also encourages people to speak up and to become engaged. We've also identified a number of conditions to bring meaningful public engagement about. And that's very simple. Organizing public engagement in a meaningful way takes time and money. It requires investments, and it also requires time and dedication from researchers and from patients. And it also requires a level of reflexivity by researchers, professionals, and patients about which role they have and how that role is complementary to other stakeholders' roles. So these are the facilitators and conditions which are required to engage the public in psychiatric research in a meaningful way. So with this, I hope I've shown you a little bit that public engagement is shaped by both its scientific domain, but also by the surrounding societal context of this scientific domain. So especially how well the patient community is organized helps determine or helps facilitate engagement in such a field. However, there are also challenges, especially in psychiatric research. We've identified a mechanism which currently limits the societal impact of participatory research practices. And we also have some ideas of how to overcome these barriers. So that's what the third part of this presentation will focus on. At the moment, we see a suboptimal societal impact of research practices in which the public is involved. As I explained, involving the public in psychiatric research also leads to alternative research designs. Patients who are involved in research design do not want the traditional RCT setup of research. They want more qualitative research designs. They want alternative research methods, and they have good reasons to want this. However, currently, scientific evaluation regimes and scientific evaluation committees are very much used to assessing the quality of research on traditional parameters, so to say. And assessing the quality of this participatory research is difficult. It's hard for them to assess whether qualitative research is as valuable and as performed as well as a more traditional RCT study. And that makes it difficult to get these types of research projects published in high impact journals, because journals are also based on reviewers, or journal decisions are based on reviewers' decisions on the quality of research. So that makes it harder to get your research published your participatory research published in high impact journals. And that in turn makes it harder to get your research funded. So that leads to two different outcomes, which are both limiting the societal impact of participatory research practices. Firstly, researchers are in fact discouraged to involve patients because they cannot publish research with patients in high impact journals, which is at the moment still important for researchers' careers. And it also leads to hampering of implementation of participatory research in medical guidelines and in standard health care, because also in deciding whether a new treatment should be taken up in medical guidelines is of course decided on by reviewers who generally still depend very much on whether this new treatment or this new evidence has been published in such a high impact journal. So it limits this societal impact. It limits the implementation of research in practice when patients are involved, which is exactly the opposite of what it aims, of course. So therefore, we have a number of recommendations for policy to encourage meaningful public engagement, meaningful engagement of patients in psychiatric research. And they're meant partly for funders. We say, which is very obvious, the costs involved with meaningful public engagement should be recognized. It takes time, it takes money, it takes dedication for researchers to involve the public in a meaningful way, and that should be recognized by funders, should be budget for it. And also we say for both funders and researchers in reviewing panels, we need to establish new and broadly accepted criteria and indicators for research quality in which the public is involved. So we need to see how to evaluate such research rather than only focusing on whether it's published in a high impact journal. And then lastly, for policymakers, both within and beyond academia, based on these new quality indicators, we need to update our evaluation regimes to include the added value to non-academic actors. So the Dutch Association of Universities has started a new program. It's called Room for Everyone's Talent. There you see it. And it aims to establish a new balance in the recognition and rewards of academics. And you see that stimulating open science is part of this new program. And we argue that it should not only be about stimulating open science in terms of open access and fair data publishing, but it should also be stimulating public engagement, stimulating researchers to engage with their stakeholders. So that was the third take-home message of this presentation. We see that the current organizational model and the evaluation regimes of psychiatric is incompatible with meaningful public engagement, and that this incompatibility limits the societal impact of participatory research practices. So I hope that with this presentation, I have elucidated each of my conclusions sufficiently now. I have some background reading which you might be interested in. And then lastly, I would like to invite you all very much to ask any questions. My email address is right here. Please get in touch with me if you want to discuss this, or if you have any further questions by either emailing me or visiting me, my LinkedIn profile. It's all. I'm very happy to get in touch with you. So that was my presentation. Thank you all very much.